Hi there, my name is Sarah. I'm going to be your nurse for the day. Before we get started, I'm going to wash my hands and give you some privacy, okay?
Okay.
So I'm going to wash my hands. And privacy. Alright, can you verify your name and date of birth for me?
Anjanette Carney, 7190.
Your bracelet. Perfect. Alright, so we're going to get a quick set of vitals from you, and then we'll listen to your lungs and go from there.
Okay.
Alright. Finger. Thank you. Alright, so I see that you were discharged 10 days ago?
Yes. I came back because I was having a hard time catching my breath, and my feet felt really tight in my shoes, and they normally fit fine.
Okay. Let's see what we got going on. Write down these numbers. And I'm going to wait for that to finish up, and I'll listen to your lungs real quick, okay?
Okay.
You go ahead and lean forward a little bit. Take a couple deep breaths. All right, thank you. Blood pressure is good. Okay. So last time when you were discharged, did they tell you about calling your physician if you had any rapid weight gain?
Yeah, but my appointment's not till next week, and so what does that have to do with me gaining any weight?
Well, I'm a little concerned because a weight gain this drastic can really mean that your heart failure is worsening. Weight gain is due to you retaining fluid, so that's probably why you're having swelling in your legs. And in severe cases, fluid can build up, back up into your lungs, and that causes your shortness of breath.
But they gave me instructions to take medication, and I've been taking them as directed, and I gave the receptionist my list of medications.
Okay. Well, let me go get in touch with the doctor real quick. We'll review your medication list, and then I'll come back and we'll go from there, okay?
Okay, thank you.
All right, you're welcome. So your call light's right here if you need anything. Give me a call. Your bed's locked in low. I'm going to wash my hands. Hi, Angie. So I just reviewed your medication list, but before we discuss things, I'm going to wash my hands and provide some privacy for you. All right. So I just talked with the doctor, and we noticed that you're taking Actos every morning, 45 milligrams. Is that right? Okay. Well, that can actually cause fluid retention, so we're going to be taking you off of that medication for now.
So that's why I was gaining weight?
That looks like it could be the problem, yeah.
Okay.
So the doctor has made a couple of changes to your medication regimen, and I'm going to discuss those with you if that's okay.
Okay.
All right, so Vasotec, you've been taking that. That's going to stay the same at 5 milligrams by mouth 2 times a day, and that's for your blood pressure. Carvedilol is a new medication that we're adding, and that's also going to be for blood pressure. You're going to take 3.125 milligrams by mouth twice a day. The Carvedilol and the Vasotec can cause dizziness, so we really want to make sure that if you have to use the bathroom, hit the call light so that we can come assist and make sure you don't fall, okay?
Okay.
You've been taking furosemide, 40 milligrams, right?
Correct.
We're going to increase this medication to 80 milligrams through an IV push. And then when we discharge you, that'll go back down to 40 like you've been taking. So nothing really changes there. We just want to encourage the fluid process to get rid of the fluid.
Okay.
Potassium chloride, which is your potassium supplement. You'll take 20 milliequivalents once a day by mouth. And then glipizide is added to your regimen, and it's a new medication. It's an anti-diabetic medication, and you'll take 10 milligrams every day.
Okay.
And then, like I said before, you won't be taking the Actos anymore.
Okay. Why am I on 2 blood pressure medications?
So that's to reduce your cardiac stimulation. Because your heart's working really hard right now, you really want to decrease that.
Okay, so is this going to make me pee a lot, and then am I staying another night?
It will increase your urine output a little bit, and we're going to keep you overnight because we want to monitor that and then monitor the progress of getting the fluid off you before we send you on your way.
Okay.
Okay. So for now, we're just going to let you get some rest. If you're comfortable, I'd like to elevate your feet a little bit to help take some of the swelling off.
Okay.
Okay. so I'm just gonna put this pillow just right under your ankles. How's that feel?
It feels good.
Good. All right, so your call light is right here. Call me if you need anything. Your bed's locked and low. I'm gonna wash my hands. Good. Good morning. How are you feeling this morning?
Good, and I'm doing a
Doing
lot better.
All right, so before we get started, I'm gonna wash my hands and give you some privacy. All right. So how are your legs looking today? Do you mind if I take a look?
They feel a lot better today. I can actually move them.
Yeah?
Yeah.
Your ankles look really good. The swelling looks like it's gone down. Good. So it looks like you're just about ready for discharge, and I have some instructions here. Are you comfortable with going over those real quick?
Sure.
All right. So it's crucial that you take your medications every day at the same time. You can get a pill organizer from the local pharmacy or from Walmart or any of the local grocery stores. And those are really helpful in keeping organized and remembering to take them on time. When it's not pouring down rain or snowing around here, we'd like you to start taking daily walks. Do you have any pets at home?
I do have a dog.
Your dog will love you for that. Yeah, 30 minutes of exercise a day is recommended, so take your dog for a walk. He'll love you. It's important to weigh yourself every day with the same scale at the same time. And in the morning is a really good time to weigh, so when you get up and you're in your jammies, weigh yourself then, because if you're weighing in the same clothes every time, you avoid variances.
Okay.
If you have a weight gain of more than 2 pounds in one day, make sure you contact your doctor immediately so that they can get you in.
Okay.
So the doctor is going to add one more medication to your regimen that we discussed earlier. We're going to be adding digoxin, and that'll help increase your cardiac output and lower your heart rate, so it'll make your heart not have to work so hard. You'll be taking 125 micrograms by mouth daily. And then I want to let you know some side effects to look out for with all these medications that you're taking: nausea, vomiting, diarrhea, dizziness, weakness, fatigue, and headache. So if you have any of those, call your doctor right away, okay?
Okay. So if I gain 2 pounds overnight, I need to call him and they can get me in sooner?
Exactly.
Okay.
Yes. Okay, and are you familiar with the DASH diet?
No, what is it?
Okay, so I'm going to give you this discharge packet. And it has everything that we just discussed in it in detail, and it also has a little bit about congestive heart failure, just a little information for you.
Okay.
On page 4, it'll list some recommendations of foods concerning the DASH diet. The goal with this diet is to limit your sodium. So sodium makes us really thirsty. So if we limit the sodium in your diet, that also reduces the amount of fluids that you'll need throughout the day. And then, like I said, page 4 will show you those details.
Okay.
Do you have any more questions for me right now?
Nope.
All right. Well, I also placed the department's phone number right here at the top. So if you have any questions, feel free to call us at any time. You mentioned you had an appointment with your physician next week, right?
Yes, I do.
All right. The doctor advises that you keep that appointment, and we want to make sure you follow up any concerns, follow up with him.
Okay.
All right. I hope you feel better.
Thank you.
Your call light's right here if you need anything.
All right,
Your
thanks.
bed's low, and I'm going to wash my hands. Have a good day.
You too.